Welcome to the video guide, Planning Your Successful Retirement for Executive Branch New York State employees. Hello, my name is Susan McLennan. I am sure you have a lot of questions about planning for your retirement, and these videos will help you with the answers for the important decisions ahead. In this video, Medicare Part 1, Eligibility and Enrollment, Sharon Beauregard, a Department of Civil Service Employee Benefits Division representative, will give you an overview of Medicare eligibility, critical details about how Medicare and NYSHIP work together, and enrolling in Medicare. For more information on Medicare, please view the other health insurance videos, which include Medicare information specific to state employees. For general information on Medicare, also view the Social Security Medicare video. You will also want to carefully review Chapter 10 of the online version of the Self-Help Guide to Pre-Retirement Planning for more details regarding the New York State Health Insurance Program. You will find the Self-Help Guide on the WorkLifeServices website at worklife.ny.gov.
Medicare is the federal insurance program administered by the Centers for Medicare and Medicaid Services. Most often, Medicare is first available to enrollees and their dependents when they reach age 65. If you or your dependent is enrolled in Social Security disability insurance due to ALS or Lou Gehrig's disease, you are eligible for Medicare immediately upon diagnosis. But Medicare is also available to people who are younger than 65 if they are disabled and have been receiving Social Security disability insurance for 24 months. And if you or your dependent is diagnosed with end-stage renal disease, you are eligible for Medicare. Together, Medicare Parts A and B make up the traditional Medicare. Part A provides inpatient hospital, skilled nursing facility, and hospice coverage. There is no charge for Part A coverage if you meet the Social Security eligibility requirements. Part B provides doctor services, outpatient hospital services, durable medical equipment, and some other services and supplies when they are not covered by Part A. There is an enrollee premium for Part B. For some people, Medicare is their only health insurance when they retire because they have no employer-sponsored health insurance. NYSHIP enrollees are very fortunate because their employer-sponsored health insurance continues even after they and/or their dependents become Medicare eligible. There are rules for how NYSHIP must coordinate with Medicare for enrollees and dependents who are eligible for both plans. These rules are called Medicare Secondary Payer Rules. These rules designate which plan must pay claims first or primary and which plan provides secondary coverage. Under Medicare Secondary Payer Rules, when you are actively employed and you or your dependents are Medicare eligible, Medicare is a secondary coverage. Your Empire Plan or HMO coverage pays your claims first. When you retire, the rules change. If you or your dependents are Medicare eligible, Medicare becomes the primary coverage. Health insurance claims would be paid first by Medicare, and your Empire Plan or HMO would provide secondary coverage. Whether you are active or retired, it is important to know how the rules affect you. Be sure to read your benefits books carefully before you retire. There are two exceptions. If you have a domestic partner who becomes Medicare eligible at age 65, Medicare becomes your partner's primary coverage whether you are an active employee or a retiree. And if either you or your dependent is diagnosed with end-stage renal disease, NYSHIP must pay as primary coverage throughout the 30-month Medicare coordination period, regardless of your employment status. NYSHIP requires you to be enrolled in Medicare Parts A and B when Medicare is the primary payer. When Medicare is primary, NYSHIP reimburses the cost of Medicare Part B premiums with the exception of any penalties assessed due to late enrollment. Each Medicare primary enrollee and dependent is reimbursed monthly the base cost of the Medicare Part B premium. Social Security deducts the cost of Medicare Part B premium from your Social Security check or bills you directly. NYSHIP reimburses you in your pension check if your payment option is pension deduction. If you are in direct pay status for NYSHIP, the reimbursement appears as a credit to your account. If the cost of Medicare Part B premium exceeds your cost of NYSHIP coverage, you will not be billed. Instead, you will receive quarterly refunds. If you are required to pay a higher Part B premium based on your income, you can apply for reimbursement for your additional cost. It is your and your dependents' responsibility to be enrolled in Medicare Parts A and B when you or your dependent becomes Medicare primary. If you and or your dependent are over the age of 65 when you retire, the Social Security Administration should be contacted 3 months before you retire. You and your dependent must be enrolled in Medicare on the first day of the month after your benefits are no longer paid for as an active employee. Your Health Benefits Administrator can assist you in determining when your coverage will begin as a retiree. If you are already retired when you or your dependent turns 65, the Social Security Administration must be contacted 3 months before the 65th birthday. We will automatically begin Medicare reimbursement for you and your eligible dependents on the first of the month that you and your covered dependents become eligible for primary Medicare coverage if it is due to age. We also send out happy birthday letters to enrollees and dependents turning age 65, reminding them to enroll in Medicare. Once you or your dependents are eligible for Medicare, NYSHIP does not pay for expenses that would be paid by Medicare. So you must make sure you are enrolled in Medicare and that it is in effect on the date NYSHIP becomes your secondary coverage. After retirement, if you or your dependents become eligible for Medicare due to a disability, please let us know so that we can update our records and notify the carriers. When you are Medicare primary, please provide your doctor and other health care providers with your NYSHIP and Medicare cards when you receive services. Inform the providers that claims should be submitted to Medicare first.
That brings us to the end of this video segment. For more details about the New York State Health Insurance Program, we invite you to view the other health insurance videos and to visit the New York State Department of Civil Service website at cs.state.ny.us. Then go to the Retirees tab on the homepage. Talk with your agency Health Benefits Administrator or call to speak with a New York State Civil Service Employee Benefits Division representative. To reach the Employee Benefits Division, call 518-457-5754 if you are in the Albany area, or call 1-800-833-4344. Remember, once you retire, the Employee Benefits Division will serve as your Health Benefits Administrator. Thank you for your service to New York State and have a wonderful retirement.